Hi, this is Deb Rny. I'm going to talk to you a little bit about my surgery. I had surgery on July 7th. I was not nervous at all. I've done a shitload of research, so I pretty much was aware of everything that was going to happen. My oldest daughter came to stay with me in case I needed help for a few days, and I'm very grateful that she was here. So we go in. My surgery was very early in the morning. They had already told me that diabetics usually get operated on first, and I was the first one, so that was great. Um, my daughter got very upset in the waiting room, while I'm getting undressed, and they're taking blood and whatever there is, and she hadn't really expressed any concern before that, but she was crying, and I'm trying to reassure her, as is everyone else, that I'm going to be fine. So that had me just a little bit upset before I went in, but I was really not afraid of the surgery. Um, I walked into the operating room, and I remember they strapped one arm to the table, but I must have been out because I don't even remember the other arm being strapped. I do not remember the recovery room. I do not remember going to my room. My daughter said that I just kept saying, I guess she saw me in the recovery room, and she said I just kept saying, I'm going to throw up, 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 just over and over and over again. I had my phone with me, but I don't do selfies. I've never done a selfie. Maybe one of these days, like Finding Elizabeth, when I've dropped a few pounds, someone will start complaining about how I have too many selfies. Um, I weighed 285 the day I went in for the surgery. I started at 330 in January when I started this whole process, so that was exactly 45 pounds that I lost. Um, I spent my entire time, once I got into my room, in the recliner. Um, my back hurts a lot, and I have this weird thing about not leaning back. So even the recliner was a problem. They always had a pillow behind me because, like, my daughter makes fun of me because when I drive in the car, my seat is sitting up straight like this. I don't know if it's got something to do with the touch of vertigo that I have, but I really do not like leaning back. Um, Everything was fine. They brought me food. They brought me a tray of food 3 times a day, with um, apple juice, Italian ice, chicken broth, orange jello, um, Isopure. I think that's it. I tried the chicken broth. I tried that once. It was no taste whatsoever. It was like drinking ugly, nasty water. So after I had one drink of that, I didn't want that again. And I also tried the Jello. I'm extremely picky about my food. I don't like orange. I only like cherry. If they'd had cherry, I probably would have been fine with that. But I took one bite of that and wouldn't eat that either. So from then on, every time they bought a tray, I would say, "You're wasting your food. Please just leave the Isopure," which I only kept because even though it tasted bad too, it tasted like it was grape. It tasted like watered down Kool-Aid. But at least I could keep that down, and I know how important the protein was, so I was going to make sure I drank that. Every time they brought a tray, I would say, "You can take all the other food back because I'm not going to eat it. Save the money, save the food, save the planet. Don't be bringing me food I'm not going to eat." No, every single time they brought the tray, they brought all the food. I don't know if they thought I was going to break down or what, but I was able to get all my Isopure, all my water. I didn't have any trouble drinking at all. I did, however, have trouble peeing. So I was not the output, whatever the technological, medical term is, um, the output they were concerned about. So they kept telling me, "You need to go, you need to go, you need to go. We're going to have to insert a catheter." And well, finally, that's what they did. That is not fun. Um, that's something they could have done while I was on the operating table, and I would have been fine. But no, I was wide awake. Um, it's bad enough. You get up every time I had to go to the bathroom, whatever little bit there was. I would get up, go to the bathroom, walk. They wanted you to do one extra lap every time you got up. So, and then I would, after I did the laps, I would come back and try to go to the bathroom again, and then I would sit down, and they'd hook me all back up to the IV, the Flotrons, the heart monitor, I don't know, whatever all the stuff is that you're plugged into. So I tried not to bother them. I felt bad because I don't know how many patients they have, but that's, for somebody to be calling them all the time. Um, but I did that. I did the laps. Well, like walking the laps and dragging the IV and all these cables, the IV pole and all these cables and cords and whatever wasn't bad enough. Now you have to add the Foley and the catheter box bag, whatever it is. I don't know. It wasn't fun. So I'd say for like the next 12 hours, maybe all I did was beg, please take out the Foley, please take out the Foley, please take out the Foley. So they did eventually take it out. I was supposed to go home. Oh, when they put the Foley in, one of the nurse's assistants happened to notice that where my IV was had bubbles all above the IV in my skin. So she said, well, your IV moved and the solution soaking into your skin, not getting into your veins. So they took my IV out of there and moved it to the other arm. Fine. I was supposed to go home on Saturday, and on Saturday morning, the surgeon that performed my surgery, Dr. Agarwala, this is a Mather Hospital in Port Jeff on Long Island, came in and told me that everything was fine, I was doing great, and that I should be going home that afternoon. Well, in the afternoon, the head of the bariatric division, I'm having a hard time with my words today. I'd like to blame it on medication, but it's not really. He came around, and I told the nurse. The nurses later asked me, did he explain to me why he was keeping me another day? And I said, yes. He said, because I was old. And they said, they were like shocked. They said, did he really say because you were old? And I said, well, he said because I was no spring chicken. So as far as I'm concerned, yes, he said I was old. I had I guess a large hiatal hernia to repair and the bypass. Everyone else that was in that wing all had the sleeve. So he was concerned with my age, and he said, "I'll let you go if you want, but I would advise you to stay." And I said, as long as the insurance company covers it, I'll stay. I don't like being here another day, but. So anyway, they let me have a shower after that, so that was good because at least I could feel human after being in there that long. Um, the the next morning when I'm now waiting, I got up at 6:30, did my little laps, whatever I was up to now, 10, 12, whatever, and asked when the doctor would be there, and the nurse said 9 o'clock. I'm like, oh my God, because the doctor. The head surgeon, when he came the day before, he said, we'll get you out early in the morning. So I'm chomping at the bit, waiting to go. My daughter's at home, waiting for me to call her and tell her that she can come get me. And then finally I'm asking, who do I have to bribe to get out of there? And the nurse tells me that they have to wait until 2 o'clock because I need another shot of heparin. So now we're trying to discuss. I hadn't taken any pain medication. I hadn't asked for any pain medication because I thought I was going to be leaving early. So now we're having this big discussion. I don't want her to give me whatever the strong stuff is that's going to knock me out because I don't want my daughter to have to try to drag me into the car. And I also don't want to be in pain. So she says, well, why don't we give you liquid Tylenol? Okay. So now she hooks the IV up. For the Tylenol, she gets that all working, everything's fine. And when she asked me, do you need anything, ice chips, whatever, I'm all good. She leaves, and I go to pick up my phone, and I notice the arm of my chair is wet, and I wipe it off, and then I notice again, it's wet again, and I lift up my arm, and I can see that the IV, now the whole portion of my forearm is in just one huge uh, um, bump. I wouldn't say a bubble because it didn't look that thin, more like a bump. So I buzz her back in, and she says, yeah, that the IV had moved, and again, it was going into my skin. So she just, I'm going home soon. I'd already had the heparin, so she just unhooked everything, and we're waiting for my daughter to get there and the discharge papers. Um, I got home. Everything was fine for the ride home. It's about with traffic, about 45 minutes maybe. Everything was fine. I got set up on the recliner. I took some Percocet, which you have to cut into 4 pieces. Really? I was shocked to hear that the Percocet's too large to go into my esophagus. I had to cut it into 4. Very strange. Um, so I the problem is I really have a hard time sleeping, and my daughter was upset. I tried sleeping in the recliner. I tried sleeping laying down. Um, I really got no rest. I also have a CPAP machine, so I had that hooked up. But I think I got like 3 hours that first night, and then the second night I decided, well, you know what? Let me try going upstairs. And I thought going upstairs was going to be difficult, but it really wasn't at all. Um, so I went upstairs and I tried going to bed, and that was horrible. I have a lot of pain on the left side on one incision, and there's also a big lump of fluid there. And if I tried laying on my left, that hurt. If I laid on my back, it would move. It was just horrible. So I finally gave up on that and came back downstairs to sleep again. And then um, the night after that, I tried again, and now I've got the CPAP mask on, and my daughter was leaving on. Now I'm going to confuse my days again, but my daughter left yesterday on Wednesday, so this was Tuesday night, and she knows that she's leaving the next day, so she's already a little anxious, even though I'm really doing fine. I'm walking my laps here, I'm taking all my fluids in. I'm going to the bathroom finally, thank God. Um, I put the mask on in the bed, and then I started coughing, and then like 3 times she came upstairs thinking something was wrong. I don't know if I was breathing weird or what. So I ended up she had to travel like 6 hours the next day. So I sent her to bed, and I tried to come downstairs and sleep again, but I really didn't get much sleep. Um, but it's all well except for the one incision is still very painful, and I still have that lump of fluid. But otherwise, I'm really doing great. I'll make another video in a few minutes about my appointment today. Thank you. See you later.